cold feet, leg cramps at night, a little numbness in your toes. Most people ignore these signs as normal signs of aging or stress. But what if I told you these aren't just minor annoyances? What if these are actually your body's first alarm system screaming that a stroke or a blood clot is forming right now? Not in your heart or your brain, but right there in your legs. Here's what everyone thinks. Stroke warning signs show up in your chest, your arms goes numb, you get chest pain, maybe slower the speech. So when your feet feel cold or your calves cramp up at 2 a.m., you think it's just because I walked too much today. But here's what most doctors won't tell you at all. Your legs are actually the early warning system for your entire cardiovascular system. By the time you feel symptoms in your heart or brain, you're already in crisis mode. Your legs will warn you months, sometimes years before disaster strikes. I'm Dr. Max, and I've been a physical therapist and medical researcher for over a decade. Just last year, I had a 42-year-old patient, a father of two, who came in complaining about cold feet. We found the beginning of a blood clot. If we would waited even 2 more weeks, we would be having a very different conversation now. And today, I'm breaking down 5 warning signs hiding in your legs that could save your life, and 4 specific vitamins that can actually reverse vein damage and prevent blood clots. Now let's dive in. Let me start with something you've probably dismissed. Those twisted, bulging veins on your legs, or those little spider web patterns under your skin. Most people think it's cosmetic. Here's the reality. Varicose veins are a mechanical failure of your circulatory system. Your vein valves are supposed to push blood back up to your heart. When they fail, blood pools in your legs, and when blood pools, it clots. This is called venous insufficiency, and it's a direct pathway to deep vein thrombosis, pulmonary embolism, and chronic leg ulcers. If you saw a crack in your house's foundation, you wouldn't just paint over it. Your veins are the foundation of your circulatory system. If they bulging and failing, everything downstream is at risk. But this next sign shows up very earlier, sometimes years before you see varicose vein. Have you ever looked down at your leg and noticed they look pale, almost bluish or blotchy? This isn't dry skin. This is your body literally showing you that oxygen-rich blood is not reaching the surface. When blood flow slows down, your skin doesn't get oxygen. That's why it turns pale or blue. But here's the critical part. Wounds heal slower, infections spread faster, and swelling become chronic. I've had patients who got a tiny scratch that turned into a months-long ulcer simply because their circulation was compromised. Your skin is like a map of your circulatory system. When the map shows danger zones, discoloration, slow healing, swelling, there is a traffic jam happening deep inside your veins. That sign is visible, but the next one is invisible and even danger, and it's probably already happening to you. Why are your feet cold in the middle of the summer? Why do you need 2 blankets at the middle of the night just to keep your toes warm? Imagine a garden hose with a low water pressure. The water that comes through is slow, stagnant, and cold. That's exactly what's happening in your legs. Your arteries are narrowing, whether from plaque buildup, inflammation, or valve failure, and blood is barely trickling down to your feet. This isn't just uncomfortable. It's a red flag that your main arteries are starting to narrow. And when those narrow enough, that's when you get peripheral artery diseases, which is a direct precursor to heart attack and stroke. Cold feet are one thing, but wait until you hear what happens when your nerves start losing their blood supply. You know that pins and needles feeling when your foot falls asleep. Now imagine that happening randomly while you are walking, standing, or lying in the bed. This happens because your nerves are literally starving for oxygen. When blood flow drops, your peripheral nerves start misfiring. It's called neuropathy, and it's often the first sign of diabetic complications or early vascular blockage. The scary part is, once nerves start dying from lack of blood, they don't always grow back. Numbness is not just annoying, it's your body telling you that oxygen is not reaching critical tissues. And this last sign, it waits until you're trying to sleep. Picture this. It's 2 a.m. and suddenly your calf seizes up in the most painful cramp you've ever felt. You hobble out of bed, stretch it out, and think you overdid it at the gym. But this keeps happening night after night. When you lie down, your blood circulation naturally slows down. If your veins are already compromised, your muscles don't get enough oxygen during the night, and without oxygen, lactic acid builds up and your muscles spasm. Here's what makes this dangerous. Night cramps don't happen to healthy people only. If you're experiencing chronic nighttime leg cramps, your veins are already obstructed. This is your body saying, I can't keep up with even basic circulation demands. Okay, those are the 5 warning signs. You might be thinking, great Dr. Max, I'm terrified. What do I actually do about this? That's exactly where these next 4 vitamins come in, because they don't just prevent damages, they can actually reverse some of it. Vitamin C is not just for fighting off colds. It's one of the most powerful tools for rebuilding your vein valves from the inside out. Vitamin C is required for collagen production, and your vein valves are made of collagen. When you're deficient, your veins literally become weakened and brittle. But getting enough vitamin C, you're giving your body the raw materials to strengthen those vein valves. And the source of vitamin C's are kiwi, bell peppers, and broccoli, oranges, and lemon. 1 bell pepper and a kiwi will cover your daily needs. And here's the warning sign. Don't megadose on supplements. Excessive amounts of vitamin C can lead to kidney stones, so be careful. And here's the one that could literally prevent blood clot in the next 30 days, which is vitamin K. Vitamin K regulates blood clotting. It tells your blood when to clot to stop bleeding and when not to clot to keep flowing smoothly. But here's the secret weapon. Vitamin K also prevents calcium from depositing in your arteries. Do you know arterial plaque? A lot of it's calcium buildup. Vitamin K keeps that calcium in your bones, not in your arteries. And here's the best natural sources of vitamin K: spinach, kale, broccoli, Brussels sprout, and kiwi. 1 cup of cooked spinach gives you more than enough. And let me give you critical points here about vitamin K. If you're on blood thinners like warfarin, do not take vitamin K supplements without talking to your doctor first. The next vitamin is a game changer for cholesterol management: vitamin B3. Vitamin B3 does 2 things for you. It lowers your LDL, which is bad cholesterol, and raises your HDL, which is good cholesterol. When your cholesterol balance is off, plaque builds up in your arteries and narrowing them and slowing blood flow. Niacin also improves vein flexibility. And the best sources of vitamin B3 are salmon, chicken breast, eggs, and nuts. A piece of grilled chicken and a handful of almonds covers you. And let me give you the warning sign here also. High doses can cause niacin flush, which means your skin might turn red and feel itchy for 20 to 30 minutes. It's harmless but uncomfortable. Vitamin E is your anti-inflammatory vessel opening vitamin. Vitamin E is a potent antioxidant that prevents oxidative damages to your blood vessels. It also helps dilation of your vessels, which naturally lowers blood pressure and improves your blood flow. And the best sources of vitamin E are almonds, sunflower seeds, extra virgin olive oil, avocado. Just a small handful of almonds meets your daily requirements. Alright, let's look this in. Your legs are talking to you every single day. Varicose vein, blue skin, cold feet, numbness, nighttime cramps. These aren't random annoyances. They are actually your body's alarm system telling you that blood is not flowing the way it should. And when blood stops flowing properly, clots form and strokes happen and lives change forever. But here's the good news. You have more control than you think. By making sure you're getting enough vitamin C, vitamin K, vitamin B3 or niacin, and vitamin E through real foods, not just just pills. You can actually strengthen your veins, prevent clot, and reverse some of the early damages. And remember, your heart and brain are critical, but your legs warn you first. Listen to them. Alright, if this video gave you a new perspective on circulation, hit that like button so I know this helps. And if you know someone who's been complaining about cold feet or leg cramps, share this video with them. This awareness could genuinely save every single lives. I'm Dr. Max, and until the next time and next video, take care of yourself and your blood circulation. Thanks for watching, and I'll see you in the next video.